continue. Okay. Okay, thank you. We have seen in the United States an increase in the amount of vein procedures over the years, and it is now probably in another year or 2 years we will see over 1 million procedures performed. As a percent of the total of the procedures, we are seeing that the invasive procedures are declining as surgical stripping and phlebectomy. However, the minimally invasive procedures are increasing: laser, radiofrequency, and sclerotherapy. But the real reason for this increase is that never before have we been able to treat venous patients in such a simple way, such positive medical and aesthetic results in an outpatient basis with very low morbidity. I read recently in the Vein News that Dr. Maletti and Perrin have even made the comment, and we have just heard, that endothermal ablation nowadays becomes, for the authors, the gold standard for treating incompetence of the saphenous system. After the introduction of the first laser in the United States, the 810 diode laser, we have seen many changes with regard to wavelength, fibers, sheaths, energy dosing, and delivery. And these all have resulted in better efficacy with very low morbidity. Currently, we have in red, is not available in the United States, but we have different wavelengths, types of lasers, and the dominant chromophores targeting hemoglobin or water. We have seen everyone moving towards the diode lasers instead of the neodymium YAG lasers because of their small size, portability, and their reliability. Of course, the wavelengths, we have seen a change going from the shorter wavelengths of 810 towards the longer wavelengths of 1470 that actually target the interstitial water in the vein wall, which minimizes perforations. However, to date, the summary of the wavelengths, there is no scientific evidence that one wavelength has a greater or a better effect in the long-term efficacy of treatment. There are different post-treatment or post-operative short-term side effects with different wavelengths. And the perfect wavelength is unknown. However, I will say that 3 of the 4 companies now in the United States offer the 1470, and that speaks for itself. Post-procedure pain and bruising by eliminating fiber wall contact, by capping or jacketing or protecting the bare fiber, we see a decrease in the perforations and thus a decrease in pain and bruising. Kabnick has shown this with the 980 laser, and I have shown this with the 1470. 70. As far as laser dosing or energy leads, we have seen, and there are some that say the shorter wavelengths, and they use this term of hemoglobin selective laser wavelengths and bare fibers, and they are usually using a dosing of greater than 80 joules per centimeter. Even with jacketed or capped fibers, with these shorter wavelengths, the same, greater than 80 joules per centimeter. However, with the longer wavelengths, what some call water selective laser wavelengths, especially with the radial fiber, we only need between 40 and 50 joules per centimeter of energy. The fiber tips began with the bare fiber, and then the jacketing of the fiber, either with ceramic, gold, platinum, and now there is the blunt or round tip radial fiber. Are bare tips fibers still necessary? Jean-Luc Girard has said protected fibers should be recommended as bare fibers have proved to be outdated. This is the radial fiber with 360-degree emission, and there's no forward emission of the fiber. With the bare fibers or the jacketed fibers, they required a long introducer and sheath, 25, 45, and sometimes 60 centimeters in length with these J wires. However, now with these round blunt fibers, which easily can be passed up the saphenous vein, they only require a much shorter introducer and sheath of 11 to 7 centimeters. There actually exists now a 400 micron fiber that uses a 6 French introducer and sheath. They also require a shorter, smaller wire and a much smaller needle. So in conclusion, the efficacy of laser ablation is very high, over 95%, but no wavelength has been shown to be statistically superior. Post-procedure recovery has improved with longer wavelengths and with protecting the fiber, either capping or jacketing, especially with the radial admission. I would just like to say that the annual Congress of the American College of Flebology will be held in Los Angeles this November 3 to 6. And I also want to tell you that the American College of Flebology, along with the president of the International Union of Flebology, Angelo Scuderi, che è scappato. Oh, ecco. We want to invite you all to Boston in 2013, in September, for the World Congress of the International Union of Flebology. I thank you for your time and your attention.